the diabetics know it best. If your sugar's running low, you better keep it near your chest. Yeah, we're here to sing a song for all the insulin depleted. We beat the drum for drugs you didn't even know you needed. Type 2, struggling with diet. You do your best, but the sugar's off. Don't be afraid to try it. This drug can work a solo shift or with a couple friends. Oral sulfonylurea or just plain old insulin. Oh, Metformin. It's an oral medication with a normal dose duration of 12 whole hours, but extended release can last a day. Don't ask about its onset, cause we'll pretend we didn't hear. And for its peak extended release, 48 hours, don't you fear. The half-life of this special drug is 17 hours and a half. Standard release has no known peak, please don't lie. Metformin's got a class by Gwenite is the name. Oral hypoglycemic picks you up when you turn gray. It's branded for the It's a real met they are. Don't worry, they're all versions of your favorite all-star. As well as treating diabetes, it keeps type 2 from ever starting. Off the book, it treats PCOS and diabetes in prepartum. Now I know it seems like magic, but there's a theory to its action. Metformin drops the liver's glucose contribution fraction. The intestine slow absorption, glucose is lowered overall. Insulin responsiveness goes up, glucose control's available for all. Metformin, it's an oral medication. No, don't use in dehydration, or if you're hypersensitive, got sepsis, low blood oxygen, don't risk in metabolic acidosis, kidneys, liver, heart effect. CHF, let's meet in treatment or in a study using ICM equipment. So now you're probably saying that this seems too good to be true. I'm seeing the reasons why you might need this drug too. Can cause diarrhea, nauseousness and pukes, anorexia and gas, lactic acidosis. Yes, it's true. You're probably getting worried now, and we've got more to say. Macroacidic anemia is rare, so is diabetes anyways. This wonder worker can leave your mouth tasting like metal. To top it off, it's known to lower your B12 serum level. Metformin, yeah, this oral medication starts your alcohol cessation, cause concurrent use with semaglutide brings up metformin levels like furosemide. Nifedipine is a drug that increases oral absorption and prolongs the peak of our friend called metformin. Drugs, it competes with its mean. Amiloride and digoxin steer elimination pathways with morphine. Not to mention procainamide, vancomycin, quinidine. methoprin, antididine, and the one triamterine. And of course we can't forget the calcium channel blockers. Together all these drugs will keep metformin in the walker. So now you might be wondering, what a nurse do with all this stuff? If you take something away, that patient shouldn't be feeling rough. Hypoglycemia's no fun, so upset should always be assessed. This drug has worked for years, and don't you should be feeling stressed. Abnormalities in nephropathy are risk for acidosis. While being on metformin, some labs should not be missed. Once in a while, electrolytes, lactate, and ketones for stars. Blood pH, pyruvate, and of course, glucose levels if you're smart. Metformin, this oral medication, teach your patients regulation in their dosage, adherence, and DM type 2 coherence. Self-monitoring glucose to ensure they don't stray too close to hypoglycemia, and protocols for what to do. Get their family involved and get them in the know how to keep their patients following their diet, exercising all the while. Make sure they know it's no cure, but metformin, if it's used pure, can help them prevent the sucky part of diet.